Hello, friends. Today we will dive into the fascinating and undeniably important world of health, discussing the early signs of diabetes and learning how to prevent this insidious disease. Make sure to watch this video until the end. There's vital information about diabetes prevention awaiting you. What is diabetes? Diabetes is a chronic disease caused by metabolic disturbances in the body. Due to insulin deficiency, blood sugar levels rise to dangerous levels. Did you know that at least 25% of people are unaware that they already have diabetes? The causes of diabetes can vary: weakened immunity, genetic predisposition, metabolic disorders, problems with the adrenal glands and pancreas. All these can lay the groundwork for the development of the disease. Early signs of diabetes. Many people continue to live their regular lives, ignoring the initial symptoms. However, during this time, diabetes could be wreaking havoc on their bodies. Let's look at the most important early signs to recognize and prevent serious consequences in time. Increased thirst and frequent urination. The first and most common symptom of diabetes is constant thirst and frequent urination. The body tries to get rid of excess sugar in the blood by expelling it through urine. As a result, you constantly feel thirsty, regardless of the season. This condition can severely disrupt everyday life, as frequent urination can disturb your sleep and make you feel perpetually tired. Itchy and dry skin. Excess sugar is expelled along with fluids, depleting moisture from tissues. The skin becomes dry, starts to flake, and itch. It's important to pay attention to moisturizing the skin to avoid injuries and infections. Scratching dry areas can lead to micro-injuries, which, in diabetes, heal very slowly and can become serious infections. Darkened skin. The appearance of dark patches with a velvety texture on skin folds is acanthosis nigricans, another early sign of diabetes. Pay special attention to the armpits, groin, neck, and knuckles. These changes can signal problems with insulin sensitivity and should not be ignored. Increased hunger. A constant feeling of hunger is a common symptom of diabetes. The body cannot process food into energy, so hunger persists even after meals. If you constantly feel the need to snack, consult a doctor. This may be because your body's cells aren't getting enough glucose needed for normal function. Chronic fatigue. A person with diabetes often feels tired and weak because the cells do not receive enough glucose for energy. The body loses its vitality, which can lead to insomnia, decreased productivity, and irritability. This condition is often accompanied by feelings of burnout and the inability to handle daily tasks. Numbness and tingling in limbs. High blood sugar levels impair circulation and damage nerves. The hands and feet are the first to suffer, leading to reduced sensitivity and even the development of diabetic foot. The inability to feel pain or temperature can lead to serious injuries and infections that may result in amputation. Uncontrolled mood swings. An imbalance in blood sugar levels affects mental state. People in the early stages of the disease may suffer from mood swings, bouts of rage, or depression. This condition can deteriorate quality of life and affect relationships with others, creating additional problems in personal and professional life. Vision problems. If your vision becomes blurry, it may be a sign of diabetes. Shifts in fluid levels in the eye, due to high blood sugar, lead to blurred vision. These changes are reversible with timely treatment, but if diabetes is not treated, they can progress to complete loss of vision. The inability to see clearly can seriously limit your ability to drive, read, or perform other important tasks. Sudden weight loss. Unexplained weight loss without diet and exercise is a common sign of type 1 diabetes, but sometimes occurs in type 2 as well. The body starts to burn fat and muscle because it cannot use glucose for energy. This condition can weaken the immune system and increase risk of infections and other diseases. Slow healing of wounds. High blood sugar levels slow down the healing of wounds by impairing circulation. If cuts and wounds take longer to heal, it's a worrying sign that should be reported to a doctor. This also relates to a high risk of infections that can be very difficult to treat in people with diabetes. Leg cramps. Cramps in the lower extremities, especially at night, can be a symptom of diabetes. Frequent cramps disrupt proper rest, leading to exhaustion. This condition can severely affect your quality of life, making you irritable and tired. Hair loss. Diabetes can lead to hair loss due to stress and changes in blood sugar levels. A reduced immune response promotes the growth of microorganisms on the scalp, slowing hair growth and causing thinning. This can be a very concerning symptom that negatively affects self-esteem and overall well-being. Diabetes prevention. To reduce the risk of developing diabetes, healthy people are recommended to undergo screening every 3 years and follow simple rules. Maintain a normal weight, engage in physical activity, consume less sugar and saturated fats, avoid smoking and drinking alcohol. These simple measures can significantly improve your health and prevent the development of many chronic diseases. Now that we have reviewed the main signs and symptoms of diabetes, let's dive into specific preventive measures and ways to improve your health. Healthy eating nutrition plays a key role in diabetes prevention. It is recommended to consume more vegetables, fruits, whole grains, and proteins. Limit your intake of sugar and saturated fats. Here are some help tips. Replace refined carbohydrates with whole grain products. Consume more fiber, as it helps control blood sugar levels. Avoid sugary drinks and prefer water or unsweetened tea. Control portions to avoid overeating. Physical activity. Regular physical activity helps maintain a healthy weight and improves insulin sensitivity. Here are some types of activities that can be beneficial. Daily walks. 30 minutes of brisk walking every day can significantly improve your health. Strength training. Building muscle helps control blood sugar levels. Cardio workouts. Running, swimming, or cycling improve cardiovascular health and overall well-being. Avoid stress. Stress can negatively affect blood sugar levels. Find ways to manage stress, such as meditation and yoga. These practices help relax and reduce stress levels. Breathing exercises. Deep breathing can help calm you down and lower stress. Support from friends and family. Communicating with loved ones helps cope with emotional burdens. Regular medical checkups. Preventive medical checkups help identify predispositions to diabetes and other diseases at early stages. It is important to regularly visit a doctor and undergo necessary tests. Glucose tolerance test helps determine how the body handles sugar. Glycated hemoglobin, HbA1c test, shows the average blood sugar level over the past 2 to 3 months. Blood pressure monitoring. High blood pressure can increase the risk of developing diabetes. Quitting bad habits. Giving up smoking and moderate alcohol consumption can help reduce the risk of diabetes and improve overall health. Smoking increases the risk of cardiovascular diseases and can worsen the condition of people with diabetes. Alcohol. Consume in moderation, as it can affect blood sugar levels and the liver. Listen to your body. It is important to pay attention to your body's signals. If you notice any of the listed symptoms or other changes in well-being, consult a doctor. Early detection and treatment of diabetes can significantly improve quality of life and prevent serious complications. Support and motivation. Preventing and managing diabetes can be challenging, but support from loved ones and medical professionals can make this journey easier. Join support groups. Talking to others who are dealing with diabetes can be very helpful. Follow doctors' recommendations. Strict adherence to medical advice helps better control your health. Set realistic goals. Small steps towards a healthy lifestyle lead to big changes. Conclusion. Thank you for watching this video until the end. We hope this information was helpful to you. Maintaining a healthy lifestyle, proper nutrition, and physical activity can significantly reduce the risk of developing diabetes and improve your overall well-being. Don't forget to subscribe to the Pure Pulse channel, click the bell, like, and share this video with your family and friends. On our channel, you will find many useful videos about health, nutrition, and the prevention of various diseases.